The classification of cancer therapy always has been confusing because of rapid increase in the cancer therapies. There is a frequently changes in those drug classification. So here I like to present in simple way and very effective way to memorize, and also I will be covering the most commonly tested topics and questions from those key points or high yield points that are most commonly expected in the board exams. So let's start. First, let's talk about the types of cancer therapies. Therapies can be divided into four major categories. One is the cytotoxic drugs, hormonal agents, targeted therapies. Targeted therapies can be small molecule inhibitors, or also there are immunotherapies, which is based on monoclonal antibodies. So these are the four major groups of cancer therapies. So let's go over each of these and then see what are those further pharmacologic drug classes within each class and what are those most tested questions from those. And also during this presentation, I will be covering the classification, then mechanism of action, and additionally the major toxicities of those drugs within each class will be discussed. Let's start with the cytotoxic chemotherapies drugs. Cytotoxic drugs, as the name tells you, cyto means cells. Basically, they act on the cell cycle, the cancer cells. Cancer cells are considered as rapidly dividing cells. So basically, these drugs they act on the cancer cell stages, different stages of the cancer cell growth, and thus by binding to them, they stop the DNA replication or cell division, the cancer cell division. That way, they reduce the cancer cells growth. So let's start. What are those cytotoxic chemotherapy drugs includes? There are two types of cytotoxic drugs. One is the cell cycle specific, and the other one is cell cycle non-specific. So as the name tells you, the cell cycle specific mean they specifically act on the specific stage of the cell cycle. So cell cycle stages can be divided into G stage, such as G1, starting from the G1, and that is also exists in the resting form where cell is not dividing. So when cell division begins at the G1 stage, which is to synthesize the enzymes that is needed for DNA synthesis, that's a step first division of the cell. That's a G1. However, cells further maybe further divide or cell may not divide sometimes. So when cell is not dividing, that is known as G0 resting state, where cell is not dividing. And then comes to the S is a DNA replication. So DNA is replication stage where antimetabolite drugs, they act them, they stop those uh, such as methotrexate, 5-fluorouracil, cetarabine, gemcitabine, they act on the S phase of the cell cycle specific phase. And also topoisomerase, irinotecan, topotecan also act through the S phase of the cell cycle. And the other class of drugs such as topoisomerase 2 inhibitors, that is etoposide, tenofovir, both of them act on the G2 synthesis phase. G2 phase of the cell cycle is where cell components are formed, which is required for mitosis of the cell division. So where topoisomerases helps in unwinding or uncoiling of the DNAs. So next, the other ones are mitotic inhibitors, which is as an M for mitotic, and also M phase, where mitotic cell division happens, and that's the place where taxanes and also Vinca alkalides, which are acts on the mitotic inhibitors. And then, so these are the examples of cell cycle specific cytotoxic drug. Whereas there are two classes of drugs in this category that are non-cell cycle specific, mean they are not specific to any stage. Entirely, they damage the entire DNA. So therefore, it does affects on all cell growth. So there are examples are alkylating agents and anti-tumor antibiotics. These are the examples of cell cycle non-specific acting drugs. Here are those questions are not very frequent, but sometime question can be expected on especially popular drugs such as methotrexate. Methotrexate is an example of antimetabolite, acts on the S phase, which is a DNA replication stage. Other ones are taxanes, which is mitotic ones. They inhibit the mitotic phase, and we'll discuss about their specific mechanisms in upcoming presentations. So let's continue to the next types of alkylating agents. So the alkylating agents are more further divided into phosphorines and nitrogen mustard and then platinum drugs. Although some references they do not include platinum drugs in this category, but platinum drugs, platinum complexes, instead of alkylating agent, platinum complexes bind to the DNA and they stop the further DNA replication. So among the phosphorins, the most popular drug is cyclophosphamide. Cyclophosphamide is the one of the most widely used anti-cancer drug, which comes in tablet, oral dosage form, and also IV infusion. So that's a oral dosage form, also very popular, and IV infusions are used in hospitals. And ifosfamide also it comes in intravenous dosage form, and the mechanism of those phosphorins are they are prodrugs. They're activated by liver enzymes, CYP enzymes, the cytochrome enzyme, which cross links the DNA by alkylating the DNA. So that way, that block the DNA replication. Whereas nitrogen mustard, as you see, those are mustard gas products such as melphalan, chlorambucils. They also come in oral tablets, and melphalan also comes as an intravenous. So these nitrogen mustards are mechanisms or belongs to the directly the DNA alkylation, I mean directly alkylate the DNA that prevent the cell replication. So that is something those drugs are known for it. So those are mustard gas type of products, which is a poisonous or toxic gases. However, these derive from those chemicals and they directly bind to the DNA alkylation. Each of these cancer therapies has one unique story how they are invented originally. So, but for now, in other sections, we'll discuss there are interesting stories of their inventions. However, for now, platinum drugs. Platinum drugs are, as the name tells you, that contain platinum metal in it, one of the most expensive metal. However, when a researcher were doing a research in the lab for microbiology, so what they found is when they're growing the bacteria in the platinum plates, a bacteria was not dividing. Instead, bacteria was getting bigger but not dividing. So that was the observation led to the platinum drug development and also used for the treatment of cancer to prevent cell division back then cancer cell division. So there are three popular drugs in this one: cisplatin, carboplatin, oxaliplatin. All platinum drugs only comes in intravenous dosage form. So they work through platinum complexes form DNA crosslinks, which is similar to alkylating agent, but they're not alkylate here. Instead, they do crosslink as a complexes, platinum complexes. Let's talk next about the major toxicities. The major toxicities of alkylating agents, some selected toxicities most commonly tested in the exam is cyclophosphamide is known to have hemorrhagic cystitis side effect. Hemorrhagic cystitis means the blood it comes in the urine. Cystitis means the bladder. So that is a major one of the serious side effect of cyclophosphamide, which is because cyclophosphamide produce a chemical substance called acrolein, intermediate substance that acrolein bind to the bladder tissues and that cause irritation and that lead to the bleeding from the bladder or the blood in the urine. So therefore, cyclophosphamide hemorrhagic cystitic side effect can be minimized by using a product called Mesna. Mesna is a uroprotective agent. That means it protects from hemorrhagic cystitis. So the next, another major toxicity is all these drugs, alkylating agents, most of them such as cyclophosphamide and platinum drugs, cisplatin, they're known to be category called high emetogenic drugs class of cancer therapies. That means they cause very high nausea vomiting. So therefore, those antiemetic drugs, generally combination of antiemetic drugs are used to prevent the nausea caused by these therapies. And other major toxicities of alkylating agents include myelosuppression. Myelosuppression is the best example is carboplatin, and also the other all alkylating agents are known to cause myelosuppression. As such, all cytotoxic drugs, which is they act on the rapidly dividing cells. So the bone marrow cells are rapidly dividing cells. So therefore, all these drugs have myelosuppressions, especially they cause severe neutropenia, or also known as the myelosuppression, also known as bone marrow suppression. So, because bone marrow has a rapidly dividing cells, therefore they're known to cause those serious side effects. So, next one other serious side effect of these drugs is nephrotoxicity. Cisplatin is one of the most nephrotoxic drug in this class. So, therefore, it is recommended to have a very high hydration, drinking lots of fluids or water. And then cisplatin also has another toxicity that is called autotoxicity, which is mainly associated with the cisplatin. So, most tested questions in the exams are from these toxicities or simple these dosage forms, and then their classes are very essential to start working. However, mechanism of action questions are not that frequent, but more frequent question from the drug toxicities and in their classifications. And also, there are other questions in this one, especially about cisplatin, which is nephrotoxic and autotoxic, and hemorrhagic cystitis, cyclophosphamide. All right, next ones are antimetabolite anti-cancer drugs. Within this class, you can divide them into antifolates, purine antimetabolites. As the name tells you, they are antimetabolites. Mean basically they interfere with the DNA metabolism by mimic like their DNA bases, like purine and pyrimidine bases. Or the antifolate mean folic acid synthesis, inhibiting them because folic acid is essential for nucleic acid synthesis. So therefore, these are the classes and pyrimidine classes, fluoropyrimidines, and cytidine analogs. These are the types of drugs combined you call antimetabolites. Among the antifolates, the major drugs are methotrexate, which comes in oral dosage form and also injections. However, oral dosage forms are widely used for other conditions such as rheumatoid arthritis and so on, whereas injections are very commonly used for chemotherapy purpose. Well, this methotrexate is similar to structurally related to folic acid, therefore inhibit the enzyme called dihydrofolate reductase. which is essential for formation of tetrahydrofolate, and from tetrahydrofolate it leads to the formation of nucleic acid. So therefore, this inhibit this dihydrofolate reductase enzyme. All right, so further other drugs are purine antimetabolites. That name tells you there is a purine base, which is a 6-mercaptopurine, also short 6-MP. They comes in tablet and oral suspensions. That's something very unique. Azathioprine is a very popular drug, which also comes as an oral tablet and injections. All right, so next, other mechanism of action of these drugs, as the name tells you, they mimic like their analog. They look like a purine base, DNA base, and then they disrupt the DNA RNA synthesis. Um, that's the mechanism of purine antimetabolite. Other ones are fluoropyrimidines, which is 5-fluorouracil, and capecitabine. 5-fluorouracil comes in injection, capecitabine is tablets. So 5-fluorouracil inhibit the thymidylate synthesis, whereas capecitabine is an oral product of 5-fluorouracil. And then the other important ones are cytidines, cytarabine, gemcitabine, azacitidine. All those comes in injection dosage form, and they basically terminate the DNA chain further for division of the cell cycle. So the major toxicities of this class include mucositis. Again, mucositis is also rapidly dividing cell. The gastrointestinal tract cells are rapid dividing cells. So therefore, these drugs cause mucositis, especially methotrexate, and that's the reason to prevent the mucositis. Often, methotrexate is co-prescribed with folic acid to minimize the risk of mucositis. And then you have a purine. Other drug toxicities are myelosuppressions because, as we discussed, they do damage on the blood cells in the bone marrow. Methotrexate, mercaptopurine, 5-fluorouracil, known for myelosuppression. And then the fluoropyrimidines, capecitabine, which is known to cause hand-foot syndrome, which is a condition that lead to the sensitive skin in the hands and foot. And then cytarabine, also known to cause conjunctivitis. Gemcitabine has a symptom called flu-like symptoms. All right, let's go to the next type of anti-tumor antibiotics. Plus, and also in this presentation, topoisomerase also presented here. So first, let's see anthracyclines, which is a type of anti-tumor antibiotics. Bleomycin is another one. Dactinomycin, mitomycin. These three are examples of anti-tumor antibiotics. And then topoisomerase inhibitors, and then here, anthracyclines are doxorubicin, daunorubicin. Those are rubicins. They come as a red color, bright red color, like a ruby. Ruby is a diamond, so it is a bright diamond color. And then these drugs are intercalate the DNA, and which is generate the free radical. For other drugs, they do free radical, but mainly they intercalate the DNA and they inhibit the um, DNA replication. Whereas bleomycin is generally works by generating free radical, which damages the DNA. Then you have a dactinomycin, mitomycin, cross-linked DNA inhibit the RNA synthesis. Whereas topoisomerase are two types here: topoisomerase 1, topoisomerase 2. These enzymes they uncoil the DNA for the DNA division. So these two drugs here, irinotecan and etoposide, is related to topoisomerase 2. All right, the major toxicities are doxorubicin is known to cause irreversible cardiotoxicity, heart failure, and that's something unique side effect, very serious side effect of this drug. Therefore, there is a cumulative dosing lifetime cumulative dosing is has some restriction on the dosing. And also, since they are anthracyclines, which is the rubicins, ruby, that means they also cause serious red color side effect. Urine, the current urine color changes to the red color. Other important toxicities are bleomycin is known to cause pulmonary fibrosis because it generates the free radicals. And then irinotecan, which is a topoisomerase 1, known to cause acute diarrhea. All right, these are the key points, and I'm hoping the big things in the board exams are especially about doxorubicin, their cardiotoxicities are most commonly tested question. Next, other types of cytotoxic drugs are mitotic inhibitors, further grouped into Vinca alkaloids, taxanes, and then these drugs mechanism is different compared to other drugs because their name tells you they work on the M phase of the cell phase. So this phase, in the M phase, mitotic spindles are essential for partitioning two daughter DNA cells. In the cell cycle phase, anaphase, that's the phase. That phase also can be important for the exam. So in that phase, these two daughter DNA cells are separated, and that is assisted by mitotic spindles. So these drugs they disrupt mitotic microtubule assembly and they disassemble, block the mitosis M phase. That way they prevent cell division. So the examples of the drugs in this category are the Vinca alkaloids is one of the old drugs. Maybe those who have studied pharmacognosy, I'm sure you had a chance to read this lot, which is the natural alkaloids. Vincristine and vinblastine, both of them comes in intravenous dosage form. These drugs are mitotic spindle polymerization. They inhibit those polymerization. And taxanes, paclitaxel, docetaxel, they all taxanes are IV dosage form. They stabilize the microtubules compared to this like inhibit. And the major toxicity of this category are peripheral neuropathy, mainly caused by vincristine and taxane. That's one of the toxicity commonly tested in the exam. So keep that eye on that one. All right, next is thalidomides, which is very rarely used because of severe toxicities. And that is all toxic thalidomide are given orally, and they do enhance T cell and NK cell activation, increase anti-tumor immunity. Although it has a more than one mechanism, but this is the primary mechanism of action. Well, these drugs are known for serious teratogenicity. So, of course, all anti-cancer drugs are not used in pregnancy, but in all cases, never use these drugs in pregnancy. All right. So next comes to these are the types of alkylating agent. Next agents are hormonal agents. Well, these drugs are primarily used for hormone sensitive cancers, cancer that are associated with the estrogen, androgen, progesterone. So therefore, you antagonize those hormones receptors, and that way you prevent those cancers induced by hormones. So let's look at what are the class of drugs. There are includes anti-androgens, anti-estrogens, aromatase inhibitors, and then GnRH, gonadotropin releasing hormone analogs, and then SERM. SERM stands for selective estrogen receptor modulators. So these are the class of drugs falls under these hormonal agents. So let's look at each class of this. Anti-androgens, the best example is flutamide, bicalutamide. Bicalutamide can be big in the exams, and these drugs are comes in all oral dosage form. Since they are related to androgenic effects, so basically they block the androgenic receptors and then they inhibit the testosterone driven cancers such as prostate cancer or also and testosterone cancers. And then the other important drug is anti-estrogen, fulvestrant injection, and this drug act selectively degrade the estrogen receptors, Intracellular estrogen receptors, they do bind to them and they degrade them slowly, and that causes the prevention of the cancers. Aromatase inhibitors are well known anti-cancer drugs. Anastrozole, letrozole, and also exemestane. All these drugs are comes as oral drugs. So aromatase inhibitor also used for breast cancers, and they do inhibit the enzyme called aromatase. Aromatase is essential for formation of estrogen from testosterone. So therefore, these drugs helps to reduce those excessive formation of estrogen, which could be contributing to the cancers, so breast cancer especially. So therefore, these drugs are very popular drugs. Then gonadotropin releasing hormones, leuprolide, Lupron injection depots, gastrelin, they also comes as a subcutaneous implants. These drugs are GnRH. They suppress the gonadotropin. Basically, they suppress the luteinizing hormone and FSH hormone, follicular stimulating hormones, released from an anterior pituitary gland. So that way, they reduce those secretion of estrogen from the ovaries, and then also progesterones. That way, they reduce those cancers induced by estrogen and testosterone. And then comes to this SERM, selective estrogen receptor modulator. There are two popular drugs in this class. One is the tamoxifen, and the other one is relaxofene. So, both drugs, among them, tamoxifen is widely used for cancer. That comes as a tablet, oral solution, and relaxofene is generally used for osteoporosis, and that is comes as a tablets. All right, so let's look at the major toxicities of these hormone drugs that are most commonly texted in the exam. And hypertension, they can increase anti-androgenic drugs, especially flutamide can increase the blood pressure, and fluvesterone can cause hot flashes. Anastrozole and also known to cause hot flashes and osteoporosis, and also the other drugs, leuprolide, Lupron, likely can increase the risk of osteoporosis and hot flashes as well. Whereas tamoxifen, known to cause increase the risk of thromboembolism risk is much higher. So those are the drugs' major toxicities. Well, what are the takeaway from this one is mainly you should keep eye on the anastrozole side effects and also Lupron, which is a leuprolide, which is a gonadotropin releasing hormone, their toxicities, and also of course tamoxifen. There we will talk about the drug interactions, and this also prodrug, so which is a major drug interactions we will discuss in other topics. All right, so let's go to the next. Next are targeted therapies, which means target, as the name tells you, target the specific molecular pathways or signal transduction pathways that on the cancer cells. And by doing so, by specifically targeting one molecular pathway, and that helps to prevent the growth of the cancer cells. So let's see what are the examples of targeted therapies. Here I'm talking about targeted therapies. They are chemically nature called small molecule inhibitor. I mean they are small chemical molecules. But there are acts on the different pathways such as tyrosine kinase inhibitor pathways, serine threonine kinase inhibitors, P13K inhibitors, PIRP inhibitors, hedgehog pathway inhibitors, smooth end inhibitors, JAK-STAT pathway inhibitors, and proteasome inhibitors. So these are the lots of them and fast-growing class of drugs in this category. First, let's talk about the tyrosine kinase pathways, which is critical for cellular signal transduction, which is essential for cancer cell growth, differentiation, and their metabolism and apoptosis, means programmed cell death. So this is the how this tyrosine kinase. Tyrosine kinase are receptors, enzyme type of receptor, and these enzyme type of receptor are the kinase type of enzymes. Means basically they assist in phosphate group transfer and that activate the proteins release. So tyrosine kinase part is here. This is the tyrosine kinase domain, and like this domain, many drugs receptors here, they on this receptor they bind to them, and therefore they stop the signal molecule further phosphorylation of the tyrosine kinase receptors, and further leading to the activation of proteins. So most drugs within this class, they do have a various uh, two types of receptor of the tyrosine kinases. One of them is present on the cell membrane, tyrosine kinase receptors, and there are other types is called non-receptor cytoplasmic tyrosine kinase. There are tyrosine kinases also present inside the cell in the cytoplasm, not on the cell membrane. Therefore there are more than several class of drugs within this tyrosine kinase pathways. Especially in the tyrosine kinase pathways are primarily there are three major targets therapies. One is called tyrosine kinase target inhibitors such as BCR, ABL inhibitors, EGFR inhibitors, ALK inhibitors. Among the BCR ABL inhibitors, imatinib, which is a brand, is Gleevec, which comes in oral suspension or also oral tablets. All these drugs of tyrosine kinase, small molecules, they come in the oral preparations, tablets, capsules, and suspensions. And imatinib is most takeaway point here, big in the exam, so keep eye on them. That's a working through the tyrosine kinase target pathway. These are the small molecule. Remember, there are monoclonal antibodies also act on the tyrosine pathways, but they are um, different pathways. So therefore, they are different. Those are immunotherapy included in immunotherapy topic. And next is the EGFR, which is a drugs called meritinib, osimertinib, and that is an important drug in this category. And next one is ALK inhibitors, which is a TNIPs, suffix is a TNIPs of them. So this TNIPs and also the TNIP, all these drugs of tyrosine kinase target small molecules targeting drugs are part of the TNIP suffix. And all those preparation comes in oral dosage form only. And most toxicities are common toxicities are QT prolongation, hepatotoxicities of this category drugs. However, the commonly tested question, what are the takeaway point is imatinib and also osimertinibs. Next, we have a serine threonine kinase inhibitors. There are two categories of that, two targets. One is a BRAF inhibitors, which is a beta rapidly accelerated fibrosarcoma, and then other one is MEK inhibitors, mitogen activated protein kinase inhibitors. So these are the examples. BRAF inhibitor example, which is important one, is a dabrafenib, which comes as a oral capsules, and also there's other phenib. Phenib is suffix of these two drugs, and here is trenib, MEK inhibitors are trenib. So there are major toxicities of in this class is dabrafenib is known to cause hand foot skin reaction, and that's a known for serious side effect. And then additionally, BRAF inhibitors also cause ocular toxicity such as conjunctivitis. And these are the next topics are P13K pathway inhibitors, which block the signals which is necessary for metabolism and survival of the cancer cells. There are two categories in it. One is the mTOR inhibitors and P13K inhibitors. mTOR inhibitors are very popular. Everolimus. Limus is the suffix that comes as the tablets and oral suspensions. And also here alpelisib, which comes as a P13K inhibitors. The major toxicities of this are hyperglycemia, immunosuppression. So, what are the takeaway point here is everolimus, which is the mTOR inhibitor oral preparations. And then next type is called cyclin dependent kinase, CDK4/6 inhibitors. So all these drugs here, they are target to the HR plus breast cancer, and they have cyclib suffix, cyclib. All of them has a cyclic suffix. And they all comes as oral preparations. Those are the two key points to remember. Next, other type of important drug in this category are PARP inhibitors, which is called DNA repair inhibitor. What it that means is basically inhibit the PARP preventing DNA repair in BRCA mutated tumor. BRCA or mutated tumor cause breast cancers, and those are mutated tumors. Is These drugs have those tumors DNAs have ability to repair the damaged DNA. So these drugs prevent those repairs. That means they prevent the repairing of single strand DNA that is especially in the BRCA mutated tumors. So olaparib, the suffix is olaparib, niraparib, paribs are the so all these PRP inhibitors are comes as oral tablets or capsules. So those are the takeaway point is those are DNA repair inhibitors, especially in the BRCA mutated tumors. Next one is the hedgehog pathway inhibitors. Also, they inhibit the SMO proteins, which is smooth proteins, which is important drugs here. Are suffix is vismodegib, which is coming from hedgehog, and then sonidegib. This is a not very commonly tested question, but just keep in mind. So all these drugs again comes as oral because they are small molecules inhibitors. Next one is another small molecule inhibitors or JAK start pathways, which is a relaxatinib, and basically they are also not that common tested question, but can be expected. Just keep in mind, which is a small molecule, which is a tinibs. All these tinibs are comes as oral tablets. All right, next ones, the last one of this category are the proteasomes or protein degradation enzymes, which are bortezomib. Zomib is a suffix for this one, and they also comes oral preparations. All right, next therapies are immunotherapies. What does that mean, sir? Immunotherapies, as the name tells you, basically you use monoclonal antibody. Most of the therapies utilize here monoclonal antibodies, and they enhance immune system so that way they can attack and they can be stronger enough to fight the cancer cells. So, but also let's see how they complicated mechanism, and let's put into simple way to memorize those class of drugs. So within this immunotherapy, monoclonal antibodies, the most commonly used drugs are checkpoint inhibitors, CAR T therapy, and then there is a called bispecific T cell engagers, BITES, and CCR4 directed therapy, CD antigen directed therapy, and conjugated therapies. Those are the examples. First, let's start with the checkpoint inhibitors. Starting with the unconjugated monoclonal antibody. I mean, they are directly are using monoclonal antibodies without conjugated with other cells. So there are important categories in this monoclonal antibodies based on their target specific proteins, such as this target CD20, the growth signals, which is also associated with B cells, lymphomas. And then other one is target HER2, HER2 receptors, which is responsible for breast cancer. And here, these are target VEGF, uh, vascular endothelial growth factors, prevents the angiogenesis in solid tumor, which is known for most commonly tested question. Vascular endothelial growth factors are responsible for angiogenesis, means the blood vessel formation, that blood vessel that supplies to the tumors. And let's see what are the examples of this. The rituximab, which is very popular drugs which target the CD20 proteins in the B cells, are also known as B cell depleters. And these drugs are comes in IV. Therefore, this require infusion and a hospitalized infusion. And then targets also HER2, trastuzumab. The brand is Herceptin. So obviously, Herceptin is part of the breast cancer. So it comes as a IV infusion plus subcutaneous, and then further, these are type of monoclonal antibodies. And then next is a VEGF1 or bevacizumab, which comes only IV infusion. So these are the three major monoclonal antibodies, not conjugated, directly acting, blocking those signal pathways that is causing the cancers and the cancer cells. So that way, by blocking them, you prevent the further growth of the cells. All right. So major toxicities of this one are these monoclonal antibodies known to have infusion reactions, especially rituximab, bevacizumab, known to cause infusion reactions. So, therefore, a rapid infusion is not allowed, have to be infused gradually for a long period of time. Plus, also, most patients who are receiving rituximab or bevacizumab, they are given diphenhydramine antihistamine before starting the infusion, just to prevent the any chance of having severe infusion associated with these drugs. And then additionally, these drugs also known to cause trastuzumab is known to cause heart failure side effect, and then uh, VEGF inhibitor bevacizumab is known to cause blood pressure side effect. Those are these major toxicities. Especially the takeaway point is for rituximab infusion reactions, and then HER2 receptor trastuzumab heart failure side effect. That is something takeaway point from this topic. All right, next comes to the CD antigen directed therapies. Again, rituximab also part of this one, and also there is a daratumab, which is worked through the monoclonal antibodies bind to the specific cancer cell surface markers. As we discussed just now, these drugs are known to cause infusion reaction, and also rituximab has a serious side effect that could be tumor lysis syndrome, TLS, and that is a common side effect of this CD antigen directed therapies. Next ones are called checkpoint inhibitors. It is very popular drugs. What is that exactly? This checkpoint in the cell cycle, there are different stages. In each stage, before going from one stage of cell cycle, there are the checkpoints. They make sure that cell growth is happening properly. So these checkpoints are um, these drugs checkpoint blocked. So by blocking checkpoint, it reactivates the T immune cells. Basically, these immune cells are inactivated by cancer cells by blocking those checkpoints. So, therefore, that will have more damage to the immune cells. So, by inhibiting these um, checkpoints, or like antibodies binding to those, and they prevent those inhibition of the checkpoints. So, therefore, these by blocking those checkpoint inhibitors can enhance the uh, basically anti, like for example, anti PD-1s permit T cell activation. So basically, you're activating the T cells. So that's a helps in fighting the cancers by those immune cells. So in this case, you also have examples PD-1 inhibitors. The most commonly used ones are pembrolizumab. The brand is Keytruda. And also PD-L1 inhibitors and then CTLA4 inhibitors. And the common side effect of pembrolizumab can be immune rash is possible. So watch for those side effects. Other drugs are called chimeric antigen receptor CAR T therapy. What is exactly this therapy is unlike other one. This is a personalized immune therapy. Means patient T cells are taken for those who have a cancer patients, and then they genetically modified, engineered to a chemical antigen receptor, chimeric antigen receptor that targets specific cancer cells. So therefore, modifying these CAR T cells are expanded in the lab and reinfused into the patient. That allows to recognize and kill the tumor cells. And this is very unique, and therefore, there's one serious toxicity associated with this. Oxycaptogene is cytokine release syndrome. That's the one serious side immune reaction of these drugs. Next ones are the conjugated monoclonal antibodies. That means basically we saw a single monoclonal antibody before, now like trastuzumab. So here you're adding trastuzumab deruxtecan together, conjugating, and that helps in fighting breast cancer. Like similar other monoclonal antibodies, you're adding another drug to it, and by doing so, you're enhancing the anti-cancer effect. Therefore, they deliver cytotoxic drug, radioactive particles, toxin directly into the cancer cells, and that helps to minimize the more effective lowering the cancer cell growth. All right, finally, we have a one bispecific monoclonal antibodies, also known as BITES. They bind to the two different antigens on the one cancer cell, one on the T cells, bringing them together for immune attack. Basically, how do you enhance the immunity here? By bridging them together. That way, immune cells can act on those cancer cells and they can minimize those. So they create the bridge between immune cells and the cancer cell that helps to reduce those cancer. All right, with this information, thank you for watching and stay tuned for more videos and